Good morning.
Good morning.
Good morning.
So let's get started. This is the special meeting of the Board of Fire Commissioners. The date is Tuesday, April 7th, and it's about 9:02 in the morning. Can we have a roll call?
Ibarra.
Here, present.
Glazier.
Present.
Hara. Ninberg.
Present.
Woods Gray.
Present.
Fire Chief Terrazas.
Present.
Deputy City Attorney Raffish.
Present.
You have a quorum, Madam President.
Thank you. This is a slightly abbreviated meeting, but we will start, as always, with the flag salute and moment of silence. Chief Terrazas.
Thank you, Madam President. Please stand, right hand over your heart. I pledge allegiance to the flag
The flag
of the United States of America.
and to the republic and one nation under God,
under God,
indivisible, liberty.
Liberty,
and justice
for all.
Please join me in a moment of silence in honor of past and present members of the Los Angeles Fire Department who devoted their lives to the protection of our community. Thank you.
Thank you. Just for anybody from the public who might be joining us today, if you wish to make a comment on any item, please dial *9, and you will get into the queue before we do public comments for any item that you wish to voice an opinion on. So our first item is report of the fire chief.
Thank you, Madam President. There's not a lot of events to share. Our focus for the last several weeks has been the coronavirus pandemic. So I really don't have any remarks, so I'll pass it back to you.
Sorry,
Madam.
I muted myself. I was muted. So
Okay.
sorry. Moving on to the consent agenda items. Do I have a vote to move them forward?
Motion.
Do I have a motion?
Second.
And then I see Jimmy. Do I have a second?
That was Andrew.
Yes.
Second.
Oh, yeah. So who's my second for the record?
So Andrew did the second.
Oh, and who did the first? Sorry.
Jimmy Woods Gray.
Okay, great. So let's have a vote on the matter. I think we need to do a roll call vote.
Ibarra.
A.
Glazier.
Aye.
Hara. Ninberg.
Aye.
Woods Gray.
Aye.
Motion carries.
Thank you. So moving on to our third agenda item, and our main item today is a verbal update on the department's response to the coronavirus. And I believe that's Dr. Eckstein who will do that.
Yes, good morning, everybody.
Good morning.
I'm sure, as everybody can imagine, this has been an all-hands approach by our department. And I'll be brief. So we've spun up the DOC. We've changed, obviously, our approach to protect our members in the field as our first priority. So we've issued a number of policy changes regarding approach to EMS incidents, emphasizing having the patient put a mask on as soon as possible. We created what's called the one-in, one-out rule, where only one member on scene approaches the patient. They try to do an assessment from more than 6 feet away. They have the patient don a mask as quickly as possible, and only that one member is wearing full PPEs with a face shield, N95 mask, gloves, and a disposable gown. We've minimized the use of high-risk procedures that tend to aerosolize the virus. And we've had a very, very consistent information flow to the field to underscore these changes, both in terms of written policies as well as videos that have been distributed through the portal. We've also made some significant changes to our dispatch system to try to have our call takers identify high-risk patients or patients known to be positive with COVID to provide better situational awareness for our members responding in the field. We've also, the department also has partnered with the mayor's office to open up testing sites across the city. Fire Prevention Bureau members and particularly inspectors help staff these sites, and we're the process of fully transitioning our fire department personnel to volunteer organization staff to man the testing sites in the city. So we're watching the metrics very carefully. We're making sure our members have the most up-to-date safety guidelines, proper supply of protective equipment. We're keeping an eye to make sure patient care doesn't suffer, but we're also working with our partners in the county to minimize unnecessary transports, particularly those patients who have known or suspected COVID-19 who do not need to be hospitalized, and adopted policies to safely allow those patients not to be transported in the field. And we also went live yesterday with our telemedicine program from dispatch to take a step further to safely identify those patients, not only whom don't need to be transported, but to safely allow us to develop what's called a no-send category, where we're not sending any resources, through a video link from dispatch with EMS physicians and our EMS advanced providers. So we've had a very comprehensive approach to maximize the safety of our members in the field, rapidly adapt based on the changing intelligence from our local, state, and federal partners. And we're trying to maximize the health of our membership to minimize absenteeism while providing maximum coverage in the field. And if and when we see the surge in the region like they've seen in the New York City area, we're trying to make sure we're as prepared as possible to have plans. We have plans in place to staff up an additional surge of ambulances, change our dispatch response protocols, and augment our staffing. So that's just a very brief synopsis, but as you might imagine, this is truly the definition of an all-hands approach that we've been working on with our partners since this pandemic began.
Thank you. Can you give us an update on how many of our members have tested positive for the coronavirus?
I believe the Chief Cooper may be able to correct me on this. I believe we've had 14 or 15 members test positive. I believe we've had 2 hospitalized, both in stable condition. So either we've been lucky or good, or a combination of both, in addition to enforcing mandatory checking of members' temperatures at the station, twice daily decon at the fire station. So we're doing everything we can to minimize absenteeism in advance of the anticipated surge in call load. So we've been very fortunate thus far.
Madam President, this is the fire chief. Can I make a comment?
Yes, of course.
I want to just add on to what Dr. Eckstein has shared with you. The count as of this morning is 12 sworn and 1 civilian who have tested positive, and 2 of the 12 sworn have returned to duty. And just as the doctor says, we've been communicating mostly with video on multiple topics to protect our firefighters. And I believe that has had something to do with the relatively low number of members who have contracted the virus. In general, looking at the entire department, our staffing is very strong. We're going to have a accelerated drill tower class go to the field this Sunday, April 12th. That's about 50 firefighters. Our call load across the board is down about 10% from our daily average, and we're averaging 1,368 calls a day. Our patient transports are down anywhere from 35 to 40% per day, and we average 591 transport. We have been, FireStat has been working with the data, and we do have a coronavirus dashboard. Right now, the percentage of transports for coronavirus-related incident types is trending up. Yesterday was 35.6%, and today was 37%, which means out of all the runs that we go that are related to the coronavirus, we're transporting 37% to the hospital. The test sites, Dr. Eckstein has done a great job with initially setting it up and working directly with the mayor's office. I'm very proud of our people who have staffed it without hesitation. They're doing a great job in staffing all the sites, and we're slowly transitioning out of that mission because we do anticipate the upcoming surge in call load. We've also been involved in the preparation of the convention center to become the medical relief center. We're using an incident management team to support that effort. We've also checked in on the needs of the Mercy, which is down in our port. The Mercy is going to serve as an overflow for hospitals in LA County. The convention center is going to serve as an overflow for the area hospitals in the downtown area. That's moving ahead. We anticipate Monday they'll start accepting patients. I want to comment on the telemedicine. That's another project that Dr. Eckstein's been involved with, and yesterday was the first day, as he stated, and I was watching the process, and I think that it's going to be something that'll be here long after the coronavirus pandemic. As you know, we've been working on this close to 2 years, and we funded it through Mayor Garcetti's Innovation Fund. We do have plans, if the surge hits us, to staff more than one console, up to 4 consoles that are dispatched by using doctors and nurse practitioners and physician assistants. So Dr. Eckstein has been involved with that heavily in the last few days. So in general, I would say that our department is leaning forward. Our staffing is excellent. Our people are motivated, and we'll be ready if that surge ever comes.
Okay, great. Great job by everybody in the department in stepping up and really becoming just even more of a valuable resource during this incredible time. Do any of the other commissioners have comments or questions?
There's a hand raised up at the top. I'm not sure
Okay.
on what item, Delia. I'll let you address, and then I'll start the timer depending on what.
Okay, great.
Thank you.
Is it Daniel Venencia?
Yes.
Okay,
How you guys
good.
doing?
Let Leticia start. We're going to give you 2 minutes. Leticia, start the timer, and then I will recognize you, Mr. Venencia.
Thank you.
Okay,
Okay.
go ahead.
So, my name is Daniel Venencia. Good morning, everybody.
Good morning.
To see you guys. I'm actually here because I'm the chairman of Los Angeles Fire Life Safety Committee. Our group, what we do is Rec 4 testing, as you guys are aware. Last week, I sent out an email to Chief Crowley regarding how Rec 4 testing should be conducted. We have some concerns. You know, how should we be entering the units for apartment buildings? You know, if so, with masks, without masks. You know, also nursing homes. You know, we don't feel comfortable entering inside nursing homes and doing testings currently. The response I received was follow the NFPA guidelines or the Office of the State Fire Marshal guidelines. But, you know, we need to bring this down to a local level and see what LAFD is going to be requiring. The building owners and managers continue to get notices to comply, but there are certain situations and certain instances that I think need to be looked at a little closer. You know, I've been suggesting for a long time now that we put together a Rec 4 committee made of stakeholders, which are building owners, building engineers, property managers, testers, inspectors, leaders of LAFD. You know, I think that we need to organize a little better and let us know how to be doing these tests. And that's why I raised my hand with the medical doctor. is what are the best guidelines for us? You know, as of right now, we're not receiving any guidelines from LAFD, so we're kind of all trying to figure it out on our own. You know, we're hoping that our leaders could guide us in this pandemic, and make sure that we're keeping not just the building safe, but the community safe as well.
5 seconds left on your time.
That's it.
Okay, thank you.
Thank you. These are unprecedented times, so we're all sort of figuring this out, and the department will help you with that as we develop these new guidelines and these really unprecedented times. But thank you for bringing this to our attention.
Thank you.
And I think that is, do we have any other public comments on Q before we opened it up? I don't believe so, right?
No, I don't see any other hands, but let me double check. Scroll down. Nope, I see no other hands raised.
Okay, so then that concludes our meeting. And can I have a vote on adjourning?
Move to adjourn from Andrew Glazer.
Okay, do I have a second?
Second, Rebecca Ninberg.
Okay, good. Let's have a vote to adjourn. I guess we need to do a roll call.
Ibarra,
A.
Glazer,
And aye.
Ibarra is not attending. Member,
Aye.
and Woods Gray.
Aye.
Okay, so we are adjourned. Thank you, everybody, for joining us remotely. Have a good day and stay safe.
Thanks, you too.
Bye.